Hi, my name is Monica Moore. I'm a registered dietitian and a UNE master's candidate. Today I'm going to be presenting my systematic review for the UNE Capstone project for August 2020, titled The Effects of Thiamine Supplementation on Lactate Levels and Mortality in Critically Ill Adults with Sepsis in the Hospital Setting. We'll go through an introduction, objective, methods, literature review and results, discussion and conclusions, and implications for research and practice. To start, it's important to know what thiamine and sepsis are. Thiamine is a water-soluble vitamin, also known as B1. It can come from food or supplementation. The RDA, or recommended daily allowance, is 1 to 1.2 milligrams per day. It is stored in the liver in small stores. Deficiency is prevalent. It can be affected by SIRS, which is the systematic inflammatory response system, or critical illness. Deficiency leads to Korsakoff's syndrome, Wernicke's encephalopathy, and neurological issues. In 2014, a hospital ICU study found that 71.3% of their 180 participants were thiamine deficient at admission. Other studies have showed 10 to 35% deficiency at baseline. Additional studies have also suggested that there is a 50% increase in mortality in critically ill patients with thiamine deficiency. Sepsis is an indicator of critical illness in hospitalized patients. It may lead to septic shock. It's a common cause of mortality in the critically ill. It's associated with elevated lactate levels. Guidelines for diagnosing sepsis were recently modified to include lactate of over 2 millimoles per liter, lower than the previous threshold of 4 millimoles per liter. Elevated lactate levels seen in septic critically ill patients were shown in the Surviving Sepsis Campaign database and other studies to significantly increase mortality when over 2 millimoles per liter. Diagnostic criteria for diagnosing sepsis includes SIRS, which is the systematic inflammatory response system, fever, elevated heart rate or respiratory rate, elevated white blood cells, altered mental status, edema, hypotension and vasopressor use, lactic acidosis, and hyperlactatemia. Thiamine and sepsis together is what we're looking at here. Previous studies look at this impact of thiamine on lactate. Current trials are also running with vitamin C and thiamine as a combination therapy on serum lactate levels. The thought is that thiamine supplementation may possibly lower lactate and thus sepsis mortality by increasing the time to resolution and improving outcomes. This leads us to our objective of this review, to evaluate the effects of 100 to 300 milligrams of IV thiamine on lactate levels and mortality in critically ill septic adults in the hospital. Inclusion criteria for this review included age 18 years or older, hospitalized, a diagnosis of sepsis or septic shock, elevated lactate levels, critically ill, and included studies of various designs. Some of the designs included in the review were randomized controlled trials, prospective studies, retrospective studies, and observational studies. No studies were included with less than 10 participants, and the range of publication years was from 2014 to present, although a few positive graded studies from earlier were included. English was the language chosen for the articles. Exclusion criteria included ages under 18, non-hospitalized patients, those that had end-of-life goals or comfort measures only code statuses, and those articles that were not written in English or studies that had the results still in process. The database search consisted of PubMed, Biomed Central, and clinical trial registration sites. Some of the keywords searched were sepsis, thiamine supplementation, critical illness, lactate, thiamine, and hyperlactatemia. A Prisma 2009 flow diagram shows how 130 articles were identified through the database search, resulting in 117 articles to screen after duplicates were removed. 97 articles were excluded due to animal subjects, pediatrics, non-hospital, abstracts only, and systematic reviews or case reports. After the eligibility screening was completed, 18 articles remained and were evaluated and included in this systematic review. Of the 18 articles that were included, 7 were randomized controlled trials, 3 were prospective studies, 5 were retrospective studies, 2 were observational, and 1 was therapeutic. All studies included IV thiamine supplementation as an intervention, whether it be solely or as a combined treatment, and had an outcome of either serum lactate or mortality. Grades were assigned based on the Academy of Nutrition and Dietetics Evidence Analysis Library Quality Criteria Checklist Guidelines. 15 articles were graded as positive, 3 were graded as neutral, and negative graded articles were excluded. So moving into our literature review, Byerly et al. In 2020 was a therapeutic retrospective study that sought to evaluate the effect of vitamin C and thiamine on mortality and lactate clearance in the ICU. 11,330 adults participated. The treatment group received either vitamin C, thiamine, or both. The control group received no supplementation. Overall mortality was found to be 25.9%, and an association between vitamin C and/or thiamine and mortality was found. Sadaka et al. In 2019 was a randomized controlled retrospective cohort study. It looked to study the use of ascorbic acid, which is vitamin C, B1, which is thiamine, steroids, and as a combination therapy in septic shock patients. 62 adults participated. The treatment group received IV ascorbic acid, 1.5 grams every 6 hours, IV hydrocortisone, 50 milligrams every 6 hours, and IV thiamine, 200 milligrams twice a day. The control group received no supplementation, but just got the standard of care. The intervention group saw significantly lower ICU mortality rates and hospital mortality rates compared to the control group. Woolham et al. In 2018 was a retrospective single-center matched cohort study. They sought to determine if critically ill patients with septic shock exposed to thiamine would see improved lactate clearance and outcomes. 1,049 adults participated. The treatment group received IV thiamine, 100 to 500 milligrams as a one-time dose. The control group was a 2-to-1 match and received no IV thiamine. Thiamine administration within 24 hours was found to be associated with improved lactate clearance and a reduction in 28-day mortality. Danino et al. In 2016 was a randomized, double-blind, placebo-controlled trial, which is the gold standard for research design. It sought to determine if IV thiamine would reduce lactate in septic shock patients. 88 adults participated with lactate levels over 3 millimoles per liter. The treatment group received IV thiamine, 200 milligrams twice a day in D5. The placebo group just received the D5. No significant differences in lactate levels at 24 hours between the thiamine and placebo groups were seen. However, 44% lactate change was seen in the thiamine group compared to a 20% seen in the placebo group. So while not statistically significant, it still is trending down. 35% of patients in this study were also found to be thiamine deficient at admission, which was an interesting addition to this study. Hemming et al. In 2020 was a prospective observational study used to assess the relationship between thiamine, lactate, and clinical outcomes in septic patients. 28 adults were included in this study. There was no treatment or placebo groups. No correlation was found between total thiamine and lactate concentration or the different types of thiamine and lactate. However, the effect of thiamine and thiamine diphosphate were lower in non-survivors versus survivors. A 2010 Danino et al. Study was a prospective observational study used to determine the prevalence of thiamine deficiency in critically ill adults with sepsis, and also to look at the association between thiamine levels and lactic acidosis. 30 adults were included with lactate levels over 3 to 4 millimoles per liter. ICU admissions were examined and the ER admissions were used as the control. 10% of patients were found to have thiamine deficiency at admission and another 10% after 72 hours of admission. No correlation, however, was seen between lactic acidosis and thiamine. A positive correlation was seen between thiamine and liver transaminases and liver transaminases and lactic acidosis. In Casserly et al. In 2015, an observational analysis, they sought to obtain serum lactate levels within 6 hours of admission for patients suspected of sepsis or septic shock. 28,150 adults were screened. 19,945 of them were included because they had lactate levels drawn and lactate levels that were seen to be over 4 millimoles per liter. No treatment or placebo groups were used, and a significantly higher mortality rate of 44.5% was seen in patients with hypotension and lactate over 4 millimoles per liter, and additionally a significant mortality increase was seen even with lower lactate levels of just over 2 millimoles per liter. In Moskowitz et al. In 2017, a randomized double-blind placebo-controlled trial, they tested if thiamine supplementation improves kidney injury during septic shock. 70 adults were included with lactate levels over 3 millimoles per liter. The treatment group got IV thiamine 200 milligrams in D5 twice a day. The placebo group just got the D5. More patients in the placebo group were started on renal replacement therapy and had worse creatinine levels than those in the thiamine supplemented group. Moskowitz et al. In 2014 was a prospective observational study that explored whether thiamine deficiency is associated with elevated lactate in patients with DKA, which is diabetic ketoacidosis. 32 adults were included. 25% of the patients were found to be thiamine deficient at baseline. Median lactate levels in thiamine deficient and thiamine sufficient groups were significantly different. 50% of the patients included in the study had lactate greater than 2.5 millimoles per liter, and a statistically significant inverse association was found between lactic acid and serum thiamine. In Falder et al. In 2010, an observational cohort study, they examined the levels of thiamine in burn patients, as well as the effects of thiamine supplementation on levels of serum thiamine, pyruvate, and lactate. 20 adults were included. The treatment group received IV thiamine 100 to 200 milligrams as a one-time dose. The control group received none. A significant association between thiamine supplementation and serum thiamine levels were seen. A significant interaction between thiamine levels and time was seen, and an increased serum thiamine was associated with a decreased lactate. Specifically, 1 nanogram per milliliter increase in thiamine resulted in a decreased lactate of 0.016 nanomolar. In Heron et al. In 2019, a prospective randomized controlled trial, they assessed the effectiveness of IV thiamine in reducing hyperlactatemia and septic shock. 65 adults with lactate of greater than 2 millimoles per liter were included. The treatment group received IV thiamine 200 milligrams in normal saline 3 times a day. The placebo group just got the normal saline. Unfortunately, no significant differences related to lactate or mortality or lactate reduction over time were seen. In Mitchell et al. In 2019, a retrospective study, they examined the effects of vitamin C, thiamine, hydrocortisone on reducing hospital mortality. 76 adults with sepsis or septic shock were included. The treatment group received IV vitamin C, 1.5 grams every 6 hours, thiamine, 200 milligrams twice a day, and hydrocortisone, 50 milligrams every 6 hours, 100 milligrams every 8 hours, or 10 milligrams per hour. The placebo group received only the hydrocortisone. They found that hospital mortality did not differ significantly between groups, and ICU, 28-day and 60-day mortality were also not different. However, ICU length of stay was found to be significantly reduced in the treatment group.